10 Early Signs of Autism in Infants. Autism spectrum disorder, ASD, is a developmental disability that affects a person's behavioral, communication, and social abilities. It is a condition that affects people in different ways, depending on the severity. Although this is a lifelong condition, identifying it during the early childhood stages of development allows for earlier intervention and, consequently, a better quality of life. If you have a baby that you might suspect have ASD, here are the 10 early signs of autism in infants you should watch out for so that your baby can get the help he or she needs early on. 1. Doesn't make eye contact. People with autism spectrum disorder generally avoid eye contact, and this is a characteristic that can be observed even in infants. A study published by Scientific Reports in 2017 shows that babies with ASD prefer faces with gazes that are averted rather than direct. 2. Doesn't respond to their name. Infants learn their name fairly quickly, although it will take a while before they are able to speak it or use it to refer to themselves. They will respond with a knowing gaze when called. By the time they are 12 months old, they will consistently react to their name. Those that do not are likely to have a developmental disorder. 3. Doesn't respond to familiar voices. Babies can typically recognize the people around them, especially their parents or primary caregivers. By the time they are 6 months old, they can respond to familiar voices with big smiles or other warm expressions. Indeed, according to an article published by the Journal of Autism and Developmental Disorders, the lack of social smiling is one of the most recognizable signs of autism in infants. 4. Doesn't reach up to caregivers. As they recognize their parents' voices and other members of the family, they also become familiar with their faces. Typically, babies reach up to familiar faces to seek comfort in being carried. For babies with autism, this is not the case, and they could even feel distressed about other people's presence. 5. Doesn't imitate expressions. Infants learn to communicate by mimicking the facial expressions, body language, and sounds they observe from the people around them, especially their parents or primary caregivers. Babies with developmental disabilities like autism often will not even recognize or acknowledge the presence of another person. 6. Doesn't babble. Babbling is a speech precursor. This is most referred to as baby talk. Generally, babies begin babbling as they approach their 12-month milestone. In the case of babies with developmental issues like autism, speech does not come until much later, or in some cases, it does not come at all. 7. Doesn't make communicative gestures. Apart from lacking early signs of speech development, infants with autism generally do not pick up communicative gestures. It takes longer for them to use their bodies to communicate as others do when waving, showing, or reaching. They might also take some time to realize the meaning of pointing. 8. Doesn't seek attention. It is common for infants to call out for their parents or siblings. Even if their speech is not fully developed yet, they might also wave and reach out to seek attention. For babies with autism, this is generally not the case, as they often do not acknowledge other people's presence. 9. Doesn't show interest in others. Babies with autism do not typically interact with other people. They will ignore the presence of others and are generally uninterested in their presence. While most babies will look towards people talking or moving, infants with autism will seem unaffected. 10. Doesn't achieve development milestones. Because it is a developmental disorder, it is no surprise that babies with autism miss typical developmental milestones in terms of speech, motor skills, and social connectivity. Although the progress of development varies greatly between individual children, babies with autism typically show significant delays and, without proper intervention, might not even show slow progress. If your child exhibits these early signs of autism in infants, bring up your concerns with your pediatrician. Unfortunately, there are no medical tests that can confirm this disorder. Instead, Your baby's behavior and development will be observed over a period so that a specialist can make a positive diagnosis. The good news is that if your child is in the spectrum, your specialist can guide you in the best ways to hone your baby's development and care for them to give them the best chance of a good life. Following our study references we use to create this video so you can do the research on your own. Thank you for watching. If you like the video, please share with your friends, and please subscribe to our channel if you haven't already done so. If you want to be notified of our new uploads, do the following. New subscribers, click on the bell icon when you subscribe. Old subscribers, please turn on all your notifications.